Hello, 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 and welcome to Teta's podcast. Today will be a very good episode. Let me tell you, I met this woman when she was rocking the stage in University of Minnesota conference. Her charisma, but not only that, her knowledge about what she does is what impressed me. Right away after, I go after her. Hey, do you want to be in my podcast? And the good news is she say yes. So not only an expert in acupuncture, but also a breast cancer survivor, for me it's an honor to have here, I want to have it right, the doctor in Chinese medicine, Amelia Bierschbach.
Excellent.
Welcome.
Thank you so much. Thank you for having me.
I'm so excited because it's so much that it can be done with acupuncture. It's so much benefits. You discover all these benefits in your own journey. So
Correct.
it's great that you're here to share it with everyone that. Thank you. Tell us, let's start as I start. We would dig in acupuncture after, but let's start when everything started for you. When was that diagnostic knock at your door? When and how you discovered it?
So I was 35 when I was diagnosed with breast cancer. I had recently separated from my husband. And by the way, I think that there's a very strong connection between the emergence of cancer and emotional stress. It's very common for women to develop breast cancer after going through grief or stressful situations in life. So it was maybe 2 months after I'd separated from my husband, and I felt a lump. And I pretty much knew right away that it was cancer. So I made an appointment with the Piper Breast Center and went in and got my, I guess they did a mammogram first to confirm, and then a biopsy, and then came back with the results that it was breast cancer.
You say you felt the lump. I all the time curious about that in women like us under 40 with the diagnostic, right? That we felt the lump. How was it? Like you at the exam, you usually do this. This is something like I like to share in that way. People know that touch your tetas. Touch it.
Absolutely, because I was not yet, I was high risk because my mother had breast cancer, but they were recommending I start getting annual mammograms at 40, and I was 35, so I wasn't there yet. So I was doing regular checks in the shower just every month or so, just checking my breasts just to make sure. I'd already had a fibrous adenoma removed when I was 18 years old, I think. So I had fibrous breasts. And so I was just kind of used to the landscape, I guess you would say. And
it's a lot going on around here.
Familiar. And then I felt a lump that was unfamiliar. And then I actually, I felt it was hot to the touch. I could feel the heat coming off of it. And it had, undefined borders. I kind of knew what I was looking for. It had undefined borders, and it was growing in size. And so I think that was how I intuitively knew what it was.
How was the diagnostic? What was the exact diagnostic? Invasive ductal, or what was the diagnostic there?
So it was stage 3. It was, ductal cancer. And it had not metastasized, so that was great. And then there was I think it was a 7-centimeter.
Oh, it was big.
Mass in my left breast.
Okay. What medical decision you take in that point? Like, it's so much going on. The medicine, of course, advanced a lot. And then that gives us a lot of options. But also those a lot of options in those moments are like, whoa, did I could a lot, like half boob, all boob, 2 boobs, implant, no implant. It's just so much going on.
So many options, and you have to make these decisions when you've just been given this diagnosis. It feels like it's coming fast and furious, and it's a lot to figure out, because I don't think there's a lot of really great information around what would it be like to have one breast versus what would it be like to, have them both removed and then do reconstructive surgery or not have reconstructive surgery. And some of it depends on your treatment as well. If you're having radiation, that changes the tissue here pretty drastically. So I think you're making these decisions before you even really know what your situation is going to be like, and that's quite complicated. So for me, right after they came back with the diagnosis, they suggested that I get genetic testing done, which I did. And it turns out that I have the BRCA2 gene mutation, which means a very high risk of recurrence of breast cancer. And when I was diagnosed at 35, my mother had just finished her second bout of breast cancer. So she then got genetic testing after I did. She also tested positive for the BRCA2 gene mutation. So that's a higher risk of breast cancer, and it's also a higher risk of ovarian cancer as well. So for me, the decision was simplified because I just said, let's do a double mastectomy and remove all of the breast tissue because I don't want to go through this twice.
Twice, exactly.
So
you go through a hysterectomy as well, or?
Well, they were suggesting that I have my ovaries taken out when I was 36, but I wasn't sure if I was done having children yet, so I didn't want to do that. Okay. So I actually held off on that, and I had my ovaries removed. I had first my fallopian tubes removed when I was 45 or something like that.
Okay.
Or maybe 48.
You're like, oh, it's time.
It was a long time ago. But they have discovered that 80% of ovarian cancers start in the fimbria of the fallopian tubes. And so you can remove the tubes without removing your ovaries because your ovaries produce all of the hormones that are really, really protective for us as we age, from early onset dementia and osteoporosis, osteopenia, early onset or early occurring heart disease. Our hormones protect us from all of those things. And so I didn't want to have my ovaries removed at such a young age. And also I thought, I don't want to have the option to have another child taken off the table at this point. So then I had my ovaries removed at 50.
Okay. It is so interesting how we take the decisions, as I all the time say to everyone, how we take the decisions with the information we have in the table. Yes. More information we have, we can get better decisions.
And you have to make a decision that's comfortable for you. Absolutely. I know a lot of people might have chosen to have their ovaries removed, and there's no judgment from me on that. If you feel like you need that peace of mind, if it's hanging over your head that you might at any point develop the cancer, then you need to do whatever you need to do to feel comfortable. For me, I felt that I knew enough about, physiology and pathology and healthy lifestyle and living that I was comfortable waiting until at least I got close to menopause or the age of 50 was the timeline I gave for myself, either menopause or 50, whichever comes first, and then I'll have my ovaries removed.
When the stage 3 is happening, it comes along with a stronger, aggressive treatment. Take us about your treatment and how you go through in that moment.
Yeah, it's so it was an aggressive cancer, apparently. So my surgeon, who was fantastic, Dr. Bretsky, shout out to Dr. Bretsky at Piper Breast Center. I loved my entire care team. They were fantastic. And I think that's another important point. Being happy with your care team and trusting your care team, I think, is incredibly important to your healing, to your treatment and your healing. I had a great team, so I'm very grateful for that.
You took a very good point that is like, I all the time say, chop around your team. I know that when a diagnostic like this arrive, we feel the urgency to, the team that delivered for us this diagnostic, let's do this. Surgeon didn't, let's do oncologist, let's do this. Correct. Chop around. If you don't feel that you trust like in your team, 100%, you feel comfortable with it, chop around.
Exactly.
That will give you a peace of mind.
And what they're recommending to you may not be the only path forward.
Absolutely.
A different doctor may have a different opinion on how your treatment should go. So I absolutely agree with you.
So you go to Piper and then you start the treatment.
I did. So it was kind of funny. Dr. Bretsky and the pathological radiologist, put me in one of those small dark rooms. They came in, they did
to have the talk.
To have the talk. They rolled up in the stool and they held my hands, and they said, okay, you have cancer. It's aggressive. So we want to get you in for surgery. And they said, we'd like to schedule you for next week. And I said, I was working at the time, traveling internationally quite a bit. And I had a trip coming up. And I said, you know what? I can't just stop my life immediately like this. I need to tie up some loose ends. I need to complete this work. I need to pass it off to somebody else. I have a 4-year-old son. I have to figure out what I'm going to do with him. I can't just, I can't just immediately jump into this. I also need to think about this a little bit. So I'm going to hold off. And she said she was comfortable with that, thankfully, which is one of the reasons that I really like
because
her.
sometimes medical teams like share that urgency with us that we're like, okay, this is something that I need to do and I need to do now. And in that rush, decisions making in that rush, I don't feel that it's a good decisions. I respect everyone, but like taking that time to let me breathe.
Exactly.
Let me take decisions.
I needed to process it.
Yes,
I needed to process what it meant for me going forward. So thankfully, she let me complete my trip. And she said, but as soon as you get back, like literally, I flew back on like, I think it was January. I don't remember, early January. I flew back that night and literally the next morning I went in for surgery. So she did make sure that she was taking care of it quickly, but she let me complete what I needed to complete.
We have a little note over here. We're live. So I will slide the microphone over here. Here we go. No, we're fine. That's what happened when you're like kind of live doing recording. Here we go.
So then we did surgery. And then I met with my oncologist and Dr. Stuart Bloom, who's retired now, unfortunately, but also a big champion of mine, hero in my life. He recommended chemotherapy followed by adjunct therapy. So I had hormone-negative, HER2-positive cancer. So thankfully, I didn't have to do radiation, but I did 12 months of chemotherapy and then an additional 6 months of adjunct therapy with Herceptin.
And it was all those changes that come with the chemotherapy, like to you?
Yeah, the hair loss and I lost my eyebrows and I lost my eyelashes. I never realized how important eyebrows and eyelashes were
until we're missing
them.
Like, whoa! Now
we're getting stuff in your eyes all the time, and you're like, oh my gosh.
You know what? I was interviewing one of the person, and then she mentioned, like, for me, everything was so complicated, so complex, so hard. But the hardest part was when I see myself in the mirror and I see myself with no hair. That hit me so deep. So I know it's a very hard part in active treatment.
Yeah.
Something also happened when you go into treatment. And it's something that basically changed the trajectory of your life. So I want to chat about what happened there, who you meet. They changed everything around those times. They were so challenging times.
That was great segue, by the way. Very impressive. So I had been friends with a man who was an acupuncturist. We'd been friends for about a year. And then we started dating. Oddly enough, we started dating while I was in treatment for cancer. So I know he likes me for me, not for my outsides. And so he was an acupuncturist, and I was not tolerating chemotherapy well at all. I would get my chemotherapy on Fridays. I would go home. I would feel awful. I would, not be able to eat anything. I'd be nauseous. If I ate anything, I would throw it up. I would have a headache. I couldn't sleep. I would be up all night. The whole weekend I would spend trying to, feel normal again. And then I'd go back to work on Monday. And it was really, and I would be just dragging and really, really struggling with it. And so he said, you've got to come in for acupuncture. And I was raised in the Western medical system. I was pre-med in undergrad. I thought I was going to go to medical school. So I had no familiarity with acupuncture at all. I really didn't even know what it was. I knew he did it, but I didn't know what it was. And so he said, you have to come in. And I thought, well, it's not going to help me, but it can't hurt me. And
Why not?
I really don't want to offend my boyfriend.
You're like, let's try this.
So I'm going to go in. And he said, come in after your chemo. So I got my chemotherapy. I went into the clinic. I don't remember what he did. I think he put 4 needles in, something like that. I fell asleep on the table. I slept for 20 minutes. I woke up. I wasn't nauseous. I didn't have a headache. I was hungry. I went home. I ate food. I kept it down. I went to sleep. I woke up the next morning. I didn't have a headache. And I was like, what?
That is when you knew. You're like,
this magic.
I fall in love with this man and this practice. That is where I feel you fall in love with the whole package.
I did. 100%. I did. And that's when I knew that I wanted to do that for other people.
Wow. Wow. what is like, let's say like, if it's a person like me that knows so little about acupuncture, but hears so many benefits about it, not only connected. Let's start with the very basic, because this is what happened. You and your partner are the part, like he founded and then you joined after your own experience and then you open the acupuncture center in Minneapolis, here in Minneapolis. Huge and wonderful center doing great thing. You are focused, of course, in people handle and going through everything that you're going through. You learn from it and then you practice. Tell us how acupuncture is and what is all those benefits that work in you and it's working right now in your practice every day to others.
Yeah. So we do have a website that we can show and walk you through a basic explanation of acupuncture. But so essentially, acupuncture is it's one tool in the toolbox of Chinese medicine, which encompasses acupuncture, acupressure, and cupping, which I think is becoming more familiar for people, and something called gua sha, which is scraping on the skin, and then many other modalities that we use, including herbal remedies as well, which are quite important in oncology. But acupuncture itself is the insertion of very, very tiny, they're called filiform needles. So it's not like what you think of getting a shot at the doctor's office or something like that. They're about the thickness of a human hair. Wow. And those needles are inserted into acupuncture points on the body. There are acupuncture points all over the body, from the top of the head, the ears, all the way down to the toes. These points are at different spaces in the body. The ear points are above superficial branches of cranial nerves. So we can actually affect the nervous system with all acupuncture, but auricular acupuncture in particular is very effective for that, as well as scalp acupuncture. And then over the body, there are points that are over muscles, they're over joints, there's spaces in joints. And then the needle goes into the fascia or into the interstitium, which is just below the skin and above the fascia. The fascia wrap around the muscles and the organs. And the interstitium also connects all of the organs in the abdominal cavity. So the needles go into these spaces in the body, and the needle, being stainless steel, being metal, carries a charge. And our body's neurons signal on a charge differential. So when I put the needle in, it carries a charge and it sets off a cascade of signaling in the body. And essentially what it does, we call it qi, or de qi, the arrival of qi. What it does is it signals the body, there's something going on here. I need you to start sending blood and fluid and attention and communication to this part of the body. And then the body tries to heal itself. So the body is always trying to come into homeostasis, which is I'm going to sort of change back and forth between Western medicine and Eastern medicine.
They kind of complement each other.
They do.
It's more, if you know how to take from one and how to take to another, and complement, like people like you, they really take the elements and do, as I say, like a good recipe. Like, okay, let me put a little more of this, a little bit of this, and let's have this recipe for you.
Well, and in terms of explanation, there are some words in Chinese medicine that just simply don't translate well to English, or it's a complicated concept. So very often qi is described as energy, and that is a very, very oversimplified way to explain it. It is a great way to explain it, but it's a very simplified way to do it. So, but essentially that's how acupuncture works. Your body's always trying to come into homeostasis. And from the Eastern perspective, we would call that the balance of yin and yang. So I don't know if you remember from our talk at the University of Minnesota Masonic Cancer Center.
And there is that graphic that a lot of people see, like
the Tai Chi
Kung Fu movies and stuff like that.
Yes, the Tai Chi symbol. Yeah. So that's yin and yang transforming into each other, which is how balance is achieved. So in the theory of Chinese medicine, disease or disharmony in the body is caused by an imbalance of the yin and the yang in the body.
Yes. It's definitely an imbalance. And in imbalance, there is not only in the body, it's what is happening, but what you mentioned early, in emotional imbalance. A lot of people, they sit down, including myself, a lot of people that we sit down at this table, we share a diagnostic, it's like, with a divorce, with a domestic violent episode,
Yes.
with a it is that imbalance and something happened. Click is a click of imbalance in my body. It's a
Yes.
click of imbalance in my cell.
Yeah.
And acupuncture sounds like it's like how we can ping, say hello to some things here in order to send signals to the whole body to, hey, we need to fight this.
Exactly. And that's another core concept of acupuncture in Chinese medicine is we treat a patient holistically for their entire selves. And in Chinese medicine, emotions are a main driver of illness. So any emotion can be a driver of illness. Too much joy, too much anger, too much stress, too much sadness. All of these things affect our organs, our vital organs, and can lead to disharmony in the body. So we got a great graphic up there right now. It looks like hopefully listeners have been reading, but you can see those little dots all over the body. Those are acupuncture points. Those are some of our main acupuncture points. So we can tap into all the body's systems.
Tell us a little bit, because now we understand a little bit more about what acupuncture is, but tell us a little bit about it's multiple articles, it's multiple research. They confirm how acupuncture can help, not only with chronic pain, but with so much more, like flashes and consequences, or like all this joint pain. Like it's just so much that acupuncture can do for us in our treatment for the cancer patient. Tell us about that.
So it has been a really gratifying full circle moment for me to graduate, begin practicing, and begin having actually another one of my care team, Dr. Miliori, who is a plastic surgeon, attended plastic surgery. He has been referring some oncology patients to me. And so it's been very gratifying to be able to work with people who are in the situation that I was in when I was 35. And I have loved that so much. And it has been really driving me to continue moving forward on this and coming onto your podcast and talking about it to listeners. And so essentially, acupuncture is great for when you're going through cancer treatment. It's also really great and really important for recovery as well. So I do want to highlight that for listeners. It's important to go in and get acupuncture when you're in treatment for cancer, but it's also important to continue it when you're done with treatment.
Like maintenance.
You maintain it when you're in recovery. So acupuncture, part of how we work with each patient holistically is that in Western medicine, you have a breast cancer diagnosis, and there are many different kinds of breast cancer. But if if you and I had the same kind of breast cancer, we would be treated in the same way. We would get the same protocol. We would get the same chemotherapy, and then they would
This is the script that you get.
This is the protocol.
You have this, so this is the script.
We do
This is
A,
your
B,
script.
and C.
And the team do that, and you go home with that little paper, and that is what it follows.
Exactly, correct. So go ahead.
This is a very good, for me, acupuncture is like a very good complement. Like we say, like it will not replace anything medical Western that you do.
No.
It hand by hand help you to go through that.
Correct. We call it integrated medicine. So acupuncture cannot cure cancer. It is not a substitute or replacement for Western medicine in any way, shape, or form. So whenever I have patients who are telling me that they, might want to stop chemotherapy and could they just continue with acupuncture, I always say, no, please don't do that.
You feel in the miracles of the acupuncture, but no. Continue with your chemo and we continue to the magic here.
Yeah, as your doctor is advising you to do, and we'll continue supporting you. But acupuncture is not a substitute. It cannot treat cancer. It cannot cure cancer. But what acupuncture can do is it can support your body to heal and to better tolerate the chemotherapy. And that was what my experience was, is previous to acupuncture, I had been really struggling. After I incorporated acupuncture and herbs into my regime, which thankfully my doctor, my oncologist, Dr. Bloom, was okay with. I brought into him and I said, actually, he said to me, I came in and he said, your numbers are great. You're doing really great. What's different? What are you doing differently? And I said, I'm doing acupuncture.
And like, blim, 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 blim.
And he said, keep doing it. He said, keep doing whatever you're doing. Some oncologists aren't as open to integrative care, and that can be very frustrating. But mine was, and so I continued doing that. And I think it really helped me to tolerate the chemotherapy much, much better. I stopped losing weight. I felt better. I had more energy. My numbers went up, like my hemoglobin went up. Everything. I was not only experiencing subjectively the benefits of acupuncture, but I was objectively also doing better.
Yes.
And so my outcome was better. And so that's what you were referring to previously with the studies that I had sent, is that there are measurable outcomes that do prove that acupuncture helps to support people in chemotherapy and in cancer treatment to do better, to have better outcomes, better quality of life, less pain, better sleep. It's kind of across the board.
And I think that more and more people, teams, health teams, and more people are getting aware of this. I may be honest about it. My team, the Piper, Dr. Perez here in St. Paul, Domingo Perez, he told me like, hey, do acupuncture, because I was complaining about my flashes. I'm like, I still have flashes. They induce menopause. They didn't take me out of the treatment. I was like, I'm having so many flashes. And he told me multiple times, go to get acupuncture.
Yeah.
Because that
That's
will
great.
help
I'd love
you
to hear that.
with the flashes and what you're going through. And I was like, because I didn't have like the knowledge out. I was like, acupuncture? Wait, what? Yeah. I'm like, okay. But it's good because a lot of time the old school is like, okay, let me give you a pill to cover the symptoms that you have right now. It's like, okay, a pill over the pill? That may not work. Let me see. How many pills I need to take in order to get rid of the symptoms and what is happening? But also it's like, you not only like focusing in what is happening in that area. It's what you say, you focus in the holistic body. Yeah. So the well-being of it. And that is something that is very Eastern oriented.
Yes.
We focus in the whole health and wellness instead of focus in the sick and treatment of the chronic disease and what is the problem.
Exactly.
When you put your energy growth, so I think the acupuncture is that way of like, put your energy in the wellness part of it.
Yes.
You have so much knowledge, you and your husband. I know if we can put their website, because if people want to know where they can go, where the resources are, where you are working so diligent in order to bring all that to the community, to people that go like us through the whole thing. So yes, we have Acupuncture Center of Minneapolis there. Oh, that is your husband. Yes, the whole founder and the whole saver in that moment that you needed the most.
And if you scroll down, thank you.
Yes, and you will find
we have the other providers working for us.
Amelia, look at that one. Good looking one. Yes. And that is what so you work with like a whole team there, and it's good. How people usually tell me about a little bit logistic about this. How people, let's say like people call, how long is like logistics speaking, like, hey, they call, I'm in treatment. I need like how fast they can go in. We're talking about weeks, we're talking about months. Like how is the dynamic when I'm interested, I'm sold, I'm going?
Thank you for asking. So you would call the phone number, and then we have 4 practitioners right now working. So we're open 7 days a week. So it won't take long to get in. If you call and you want to get in for treatment, we should be able to get you in within the week for sure, depending on your schedule and when you want to come in. We do also take insurance, and so you can check.
You do? Yes, they take insurance, everyone. Are you kidding me? Everyone see the economy, how it's going?
Yeah.
Yes.
And you can often get a referral for acupuncture through your oncologist,
medical
through your care team.
And that way you can, that is very good, because let's face it, medical treatments, and when you go through all these decisions, like, it's a lot of cost. It's a lot of financial burning when you hear that cancer work. So of course it's a huge part that you take insurance, that you helping in that way that they can. And that is part of the connection that is right now of like, they understand better things like these practices, ancient practicing, because this is an ancient practice that people like you and your husband bring to us right now and keep it for us right now. So it's like they understand, it's benefiting this. Let's cover this as well. So
So not all plans cover acupuncture, unfortunately. And the insurance companies really don't care what I and my husband have to say about that, but they do care what patients have to say about that. So So
go.
if you find that acupuncture is not covered under your insurance plan, but you would really like to have the acupuncture, I would say call your insurance company and just tell them. It doesn't mean that they're going to change your plan, but just say,
Have
hey,
the conversation.
yeah, exactly. Have that conversation. Tell them that you want acupuncture to be covered. And the more patients that call and say, I want coverage for acupuncture, the more likely it is that it will be more commonly covered.
And that is something that I want to share with you all. Like something that starts for you, that curiosity of like, hey, let me try. Like we going to so much in treatment, in pain, active treatment or after treatment. Like let's say like all the consequences of have a diagnostic like cancer, it go after treatment. So if you're in active treatment, this will help you to go with the symptoms, like to help you navigate the symptoms and the active treatment you go through. If you go after treatment, they will help you with the post active treatment situation that we all going through. So it's even like a completely package, like for pre, during, post, like the whole package.
Yeah.
So it's like, even if you like curious, like, hey, let me try this. Let me give it a chance. Yeah. It may happen what happened to you. Yeah. You give it a chance and you're like, wow. Yeah. This actually works so good.
Yeah, acupuncture is good for everything. When people come in and they say, what is acupuncture good for? And I say, well, what is it not good for? It's good for everything. If you break a bone, I can't heal your bone, but I can help support your body to heal faster. Yes. So yes, it's good for everything. So it's not, I don't know what, I think most people think of acupuncture treating pain or musculoskeletal conditions, which it is excellent for, but it is also excellent for cancer care and for autoimmune disorders, for menopause, irregular period and menstruation, fertility, mental health concerns, digestive concerns. Yeah, I mean, if, you name it, it's
the whole well-being. Yeah. Even the fact I was very like, when you tell me like, yep, and that night, I eat, and that night I sleep. Just the fact that can help you with that two basic things that are so needed for our body to heal.
Correct. Yeah.
Even if you don't have a diagnostic, sleep and eating is something that we all going through in this very moving and rushing speed we going in the world right now. So it's like very good to get to support that. So
absolutely.
I'm sold, everyone. I'm sold. So I'm super sold. So that's
come in and see me next week.
I'm definitely going to see you. Like this is a fact. My oncologist has been telling me every time. I'm like, and he's like, well, try acupuncture. Yeah. And I was like, okay. So finally, it's destiny. Like when I go to a conference in University of Minnesota and I saw you so animated, sharing like a little, even you shared something that I stuck with me. Like you have like headaches and you have these points that you have like, it's little things that you can do in your body that can help you. Yeah, and that is something that when people visit your practice, you share with them. Like, hey, it's little things that you can do also in home that can help you to carry on the practice that we have right now in the acupuncture center in Minneapolis.
Exactly. And it's not just acupuncture as well. You were talking about acupressure, pushing on these points. And then also, we'll recommend things like breathing exercises and Qigong or Tai Chi, which also helps to move Qi in the body and things that you can do.
All about that energy.
Exactly. Keeping those things moving is so important. And so we also advise on dietary concerns.
Yes. And, what we eat is very important.
It's
what we
very
consume.
Important.
What we consume, and what I say, like what we consume, not only in our food, what we consume in our relationships, what we consume in our media, and what we consume in our phones, what we consume in every way.
Couldn't agree with you more.
It is very important to be conscious.
It's extremely important to be conscious of that, especially, all the time, yes, but especially when you're in treatment and when you're recovering from treatment. That is the time when you really want to be conscious of what you are feeding yourself. Like you're saying, not just the food that you're feeding yourself, that is very important, but also the relationships that you're surrounding yourself with. Are they supportive? Are people supporting you? Or is it negative energy that, you really don't need in your life right now? And making those decisions. It's very, very important to surround yourself with good energy, good exercise, good food, all of those things, good relationships as you're trying to recover.
Say it's a very good to it's important to be selfish.
Exactly.
When you are supporting your body, because let's face it, yeah, you have a diagnosis like cancer, but your body is fighting for you. Your cells, they want the best for you.
Correct.
So how I can support the most my body right now in this battle that we both, my body and I, are fighting.
Exactly.
So it's like how there I can just go and navigate what I need to put in my plate, what I need to do in order and be selfish. I feel like for me it was very hard.
Yes.
It's because I'm like, very independent. I don't want to ask for help. I don't want to do. I don't want to bother people. No.
Yep.
You know what? Sometimes you asking for help is a gift that you give to others. They love
because
you.
they want to help you.
They want to help you.
Everybody wants to help you. They want to support you.
That is the moment to be selfish, just do your thing. More than acupuncture, that I know is a huge part of you, is something else there that help you, Amelia, with not only during treatment, but right now that's helping you to navigate through a cancer, because a cancer diagnostic is not something that is only there and pass away. It's something that we carry on for life.
It's
correct.
Lifelong. Yeah. So I really was able to get in touch with my spiritual practice when I was going through treatment. And so I practiced the Buddhist path. And so I had a little picture of the medicine Buddha and a little medicine Buddha mantra, and I put them on the inside of my cupboard because, as you were referring to earlier, there's so many medications that you're on when you're going through treatment. So I would open up my cupboard and I would say the mantra to medicine Buddha, and then I would take all of my pills, take the water, and then, just make the aspiration that, I could be healthy, and that these medicines would help to heal me, and that everybody else who was going through this would also be healed, and may nobody else have this experience. May this experience end with me. And that has continued. That really helped me to get through the experience. I think there's always a little bit of an existential crisis when we're confronted with a diagnosis that there is always a probability, there's always a small potential outcome that you could die.
Of course.
And so even though it's come a long way and, a lot of treatment is successful and we have so many survivors, and I'm so grateful for that, there are those that we've lost.
Yes.
And so when you're confronted with your own mortality, that's a pretty big existential crisis to deal with while you're also going through treatment, while you're doing all this stuff. And so for me, finding that spiritual outlet was a lifesaver. And then that still helps me to get through in my daily life. So it also helps me, when I'm working with patients, I like to make sure that I've centered myself and that I am in a good place when I'm treating somebody. And so I will still sit down and do my meditation practice and make sure that my motivation is correct. And then I'm able to engage with my patients fully and bring that energy to them. So
be a channel for that energy. So beautiful. Thank you
for that healing energy.
I know. Thank you for sharing that and the importance of connecting with something and make that helping tools with an extra force, like whatever is faith, spirituality, tools, practices, but connected with something else in order to help you navigate that journey. Before we go, I want to share a little bit with you of this. This is a Spirit Junkie cards.
Oh, that's cute.
So we shuffle. I will give you one of those. You can take it.
Okay.
It give a message. So what message will give? We don't know.
Okay.
And that is you again for you to take home. It was given from me to one of my closer friends, and I truly love it being sharing with people this. So
this is
please
great.
Share it.
I claim my desires. I hold great visions. I am ready to receive.
I hope.
Thank you. This is great. I love this.
Oh, it's beautiful.
It's really
yes, you show it to that. Maybe we'd see it over there. Cute. Magic. And always first, before we close in with your mantra or message or quote that you want to share with everyone, I want to say thank you. Thank you not only for what you do in this space with us today of sharing of that practice with everyone, that tool, that knowledge, and that a little seed, put it in them that this is something that can help you and it can grow and then can truly help you. Thank you for you doing it in your practice with your husband. Thank you for all that, because seriously, I feel it brings so much peace and help in that journey. As I say, like, you're not curing people, but you're helping people to navigate that journey. So thank you for everything you and your husband do
Thank
for
you
all
so
of us.
much for letting me come on and talk to everybody about acupuncture, and I really appreciate it.
So we will close with your favorite, again, mantra, quote, message, whatever you have there to share with the world.
One of the things I like to say to myself is I am right where I am supposed to be right now. I feel like that's great for many different situations. Just I am where I am supposed to be right now in this moment.
Amen. Amen. We are here where we're supposed to be. So thank you so much, Amelia,
Thank you,
to share this
Vanessa.
moment with us.
This was great.
Thank you,
Thanks for
all
listening,
of
everybody.
you. Thank you for listening. Stay tuned for more episodes. Every 7, episodes coming. So stay tuned. Tetas Podcast.